Greetings, my Beyond the Care podcast family. I am your host, Dr. Paula. Today, I'll be talking to two dynamic researchers who are studying the genetic link in Alzheimer's and the family history. So, if you've had someone in your family who's had Alzheimer's, please reach out to these researchers to find out how you can be involved and included in studies looking at the genetics and the family histories of Alzheimer's. It's so important that we're involved in research and clinical trials and studies, because that way it will help to identify cures, it will help future generations. So please take down this information that we'll provide at the end of this podcast and find out more about how you can help support ongoing studies for Alzheimer's. In addition, they have what's called a Caregiver College, where they provide information and resources to educate caregivers. So I hope that something that you hear in today's episode is valuable to you on your caregiving journey and it speaks to you. So thank you for tuning in. Hello, my Beyond the Care podcast family. I'm so excited today to have two phenomenal women with me. Let me introduce them. First, we have Dr. Allison Caban-Holt. She's a researcher at Wake Forest University School of Medicine in Winston-Salem, North Carolina. She completed her doctoral studies in clinical psychology at the University of Tennessee and her postdoctoral work at the Sanders Brown Center on Aging Alzheimer's Disease Research Center at the University of Kentucky. She has spent much of her career focused on the inclusion of underrepresented people into research, specifically focused on Alzheimer's disease and brain health studies. Dr. Caban-Holt is creating a program of research around community outreach and engagement to achieve more effective recruitment in research studies. Most recently, she's helped develop and implement a program for increasing knowledge and awareness of Alzheimer's disease that has reached over 200 caregivers of persons with dementias in 4 cities in North Carolina. Welcome.
Thank you, Dr. Paula.
Hello. Next, we have Dr. Doreen Fortune. She is a biomedical scientist, educator, and visionary leader dedicated to advancing health and education equity for underserved populations. She holds a PhD in comparative biomedical sciences from North Carolina State University and continues to lead initiatives that unite biomedical innovation, public health, and education equity to empower communities and shape a healthier, more equitable future. Dr. Fortune currently serves as program manager and research scientist at the Wake Forest School of Medicine, where she leads transitional health equity initiatives addressing Alzheimer's disease and chronic disease prevention in African American communities. Welcome, welcome, ladies. Again, so glad to have you on. You have a wealth of knowledge and looking forward to this conversation with you both. So, tell me a little bit about yourself. I know, Dr. Fortune, you have been a caregiver, not for someone with dementia, but you have been a caregiver. Tell me a little bit about that experience.
It was initially, it was fine initially. My dad left New York after Hurricane Sandy hit. He came down here to stay with us for a while. And everything was okay. And then his health began to decline. He was diagnosed with primary myelofibrosis, which is a bone marrow disease. And this came about after radiation from prostate cancer. And initially, I didn't even see his decline because he was in the house. And my father has always been a strong figure. So he was a person that pushed through. And being so close and intimate with him, it was initially, I felt like I missed it. But once he started declining and talking to the doctor, it was tough. I'm a mom. So I was part of that sandwich generation of caregivers where my dad's in the house and my teenage son as well is in the house. And so it was a difficult time. I was grateful that I had the opportunity and the flexibility that so many people do not have because I work from home. At the time I was working from home. when he started to decline. Initially, I was in the office in higher ed. And so it allowed us, it helped our relationship. Not that we had a bad relationship, but it brought us back to being very close. But I had to have a tight schedule. I had to manage things. I had to be proactive in my planning. I had to be comfortable with saying no at times when I really felt I needed to say yes, whether it was work with friends, or just personal engagements or times with my son. And so it is not easy. And I have a sibling, but my
Okay.
brother is still in New York. And so he and I had conversations, and it would be interesting. Sometimes he would want to dictate as to what needed to be done. And if
Hmm.
I didn't agree with him, I'm all the way here. But, he was a good sounding board to talk things out with and to consider dad's health and how we move forward. But then when it eventually became very hard, I didn't have to put him in care, but my son had to step in. My dad's a strong guy, not he's very muscular, and just picking him up, it got to the point where I had to put him in the bathtub, get him off the bathroom, and he didn't want me to do it. He would refuse to shower or bathe because he
Hmm.
didn't want me to do it, and he had to let his guard down to allow his grandson to begin helping him. And so it was it was a learning process. What I did notice, it helped my son really truly understand what family and community looks like.
Hmm.
When you step in, it is something I would never wish on anyone at all. It was difficult. It was a difficult time. It was a hard time. I learned a new word as within the caregiver experience, anticipatory grief. I saw my father, once I really began seeing him decline, I was
Hmm.
grieving because I knew his time was eventually going to come, even though I tried to fight that feeling.
Hmm.
But it did. He did eventually pass away November of 2023.
Okay. Sorry for your loss. So you both are at Wake Forest University and you do research on Alzheimer's disease. Tell me a little bit about your research and what you do there.
I can start. So right now, Alzheimer's affects almost 7 million people right here in the United States. And those numbers are expected to double, in the next, 20, 30 years. So it's really important that we have a chance to really get our arms around what is going on with this disease. African Americans, we are twice more likely to develop Alzheimer's disease than other groups. And that's, and Alzheimer's is one dementia. There are lots of other forms of memory loss that affect us. Women are, of those who develop Alzheimer's disease, women are two-thirds of those.
Mhm.
So when you combine sort of the intersection of ethnicity and gender, it really affects, it's really going to affect African Americans, specifically African American women, both as the patients, but also as the caregivers. Women tend to be the caregivers for loved ones in general, for anything, but certainly for dementias in particular. We feel like it's tremendously important that we better understand this condition, help to find treatments for it. I would love one day for us to never have to study Alzheimer's again because it's just done. We don't need to worry about dementias anymore. But
Mhm.
that's just not where we are right now. And we really need for there to be great representation of different people in the research so that if we find a cure or a good treatment, that it will work on everyone. The work that we do here, a lot of the work that we do is both with individuals, people who have Alzheimer's or other forms of memory loss, as well as people who don't have it. We have to have something to compare to. So if we don't know what normal aging is, it's going to be hard for us to understand when a person is starting to develop dementia. So we need folks who are cognitively doing fantastic, and we need people who are experiencing forms of memory loss. We also are looking at the genetics of Alzheimer's. So we are also looking at families, some aspects of the development of dementias, we believe have a genetic component to it. And we really need to understand that better. So the work that we do, we look at cognition, we take family history, we take a blood sample, and we will come out to where people are, and so that they don't have to travel. And this work has, over time, has developed, we've found unique kinds of genetic markers for dementias that have not been found before. So we're making progress. And some people may not be aware that there are some new medications now that are infusions that are some of the first that actually remove some of the structures in the brain that cause dementia, specifically focus on the beta amyloid plaques that are one of the hallmarks of Alzheimer's. Those medications would not have been developed without research. So we think it's really important that lots of people get involved and know their rights as a research participant.
Right. So two things you said that I just want to touch on. One, as someone whose mom had dementia, I'm always, in the back of my mind, the genetic link and saying, this could happen to me. So it's always a scary feeling. So it's so good that you're doing research on the genetic link and the family history. But about your research, we know that we have mistrust in research, going back to Tuskegee experiment. How have you found it to get participants to be engaged in your research, to be involved in your research? And what are some of the strategies that you use to outreach for research and inclusion in your studies?
So it can be challenging. Certainly, different groups, particularly people of color, may have some level of mistrust or distrust that is well founded. So that's one thing I want people to understand. It didn't just come out of nowhere. There's some reasons for it. And so we need to address those when it comes up. So a few things that we really need to think about is, do people have the information that they truly need to make decisions about joining a research study? I think that's part of it is, are we answering people's questions? Are we giving them enough information to make a decision? So that's one thing we in the work that we do, a lot of our outreach is about educating people. I was just yesterday in Fayetteville, North Carolina, doing an educational event at a senior center. And it's important that we give people information that they need. Also, we need to educate people on what are your rights as a research participant. You can stop your participation or limit your participation, to the extent that you're comfortable with. And something else, people may not recognize that not all research is the same. Some research, the research we do, you're not required to take any medication or anything of that nature. So I think getting to understand what your rights are, understand what kind of research you're participating in, and get to know the researchers. I'm one. Dr. Fortune's one. Get to know us, and so that you don't feel like there's this person, in some ivory tower who's doing this research, but it's Allison at the senior center talking to you and answering your questions, and you can call me and answer questions. So it can be challenging, but I think even if you don't join the study, if I've educated you about what it's like to participate in research and what your rights are, and I feel like I've done, some important work.
Okay. Now, some of your research has been on caregiver experience. Do you want to talk a little bit about that? What have you found? What's your research focused on?
I would love to. And so with the experience, so what we've been looking at is really to educate, support caregivers. And we're doing this because what we know is they have a huge burden. They come in to this diagnosis with absolutely no information. And even once the diagnosis happens, no one explains to them what to look for and what's going to happen.
Yes.
And it's really hard when you don't understand the progression of the disease and what's going on. And so we've created and developed a program that addresses those needs. It provides education, providing them with an overview of Alzheimer's disease, treatments, management of the disease. We explain why it's so prevalent in health African Americans by sharing the health gaps that occurred and why they happened. And then what we do, what I find is unique, prior to offering the Caregiver College, we go into the communities and have a focus group and get with caregivers who are currently or maybe in the past have worked with or been a part, a caregiver of their loved one or, a friend, and some community stakeholders as well, other community stakeholders or organizations and agencies. And they share with us their experience. They share with us what resources and support may or may not be available within that community, what knowledge they feel they're lacking, and what their greatest needs are. And we design the Caregiver College specific to those particular needs. The first Caregiver College at Wake Forest, the first few, we went a little bit further by educating caregivers to present this information within their communities and then go out into the community to share what they've learned. And doing this, those two caregiver colleges, we had about 50 individuals, but we were able to impact and share information with close to 1,000 people because these caregivers went out and shared that information. And so we've had the opportunity now to expand into tier 1 counties in North Carolina that are more low economic, and a couple of I think 1 or 2 tier 1 counties as well. And so we have different models based on the different environments and the needs within those communities.
Wow. So it's called the Caregiver College. I'm a little upset that it's only in North Carolina. It sounds like something that needs to be
That's just the start,
expanded.
right?
It's just the start. Exactly. So how did you come up with this Caregiver College? How long is it? Who can be involved? Tell us a little bit more about Caregiver College. And I love it. I love it.
That's great. I'll start and I'll let Allison follow up. And so it originally started at A&T.
Okay.
Their research center. Dr. Goldie Bird developed the Caregiver College there. And once she transferred to Wake Forest, she brought the idea over. Allison, serving as the associate director, led that project. And Allison and I eventually started working together. And so that's how the Caregiver College initially started. And there was also a grant, if I remember correctly, with Senior Services, correct, Allison? And that grant helped with, funding, those funding needs that we needed with the Caregiver College.
To add to what Dr. Fortune was saying, some of the things that we've added once we moved started doing the Caregiver College with Wake Forest was a really strong program of developing community ambassadors. That was sort of one of the primary things we really wanted to do. Once someone gets gets the information and gets a little bit of training for them to go out into their community, then they're a trusted person.
Like train the trainer.
There you go. And that's what we did. And that's how we were able to reach so many people. So you do have, they're gaining this information to use for themselves, but then them sharing it makes it exponentially more, even more valuable. And even though we're doing Caregiver College primarily in North Carolina, we're willing to go on the road.
Okay now. Okay. So how long is the Caregiver College?
Oh, that's a good question. So it
Mm-hmm.
varies. It depends on that community. So
Mm-hmm.
we have had several formats. 5 days where that's the primary, the hallmark, because that was the first caregiver college. It was intended for 5 days to train CHAs to go out into communities. However,
Okay.
every community did not see that. Every community I would say wanted that, but they just did not see that happening at the time
Mm-hmm.
for so many reasons, environment, time, accessibility, help, with their loved ones. And so we've had the ones where we train the trainer or train the CHAs, those were 5 days. But we've had 1 day conferences, we've had a 3 day format. And so it varies. It just really depends on what the community tells us that they need and how we
Mm-hmm.
work within their community.
And at the end of the 5 days or the 3 days, what are you certified? Are you a certified caregiver or you just have this information and knowledge?
So at the end of the 5 days, we sort of have like an informal graduation.
Mm-hmm.
And we do ask them to go into their community and do two educational events or activities in their communities. And so we ask them to try to spread the word
Mm-hmm.
um, on Alzheimer's, as well as if they find that there are people in their community who need more assistance and help, to refer them back to us, and we'll try to connect them with resources that we have access to.
That's such a great thing. In my research with caregivers, I found that one, they felt they were not prepared. So, as you mentioned, you get this diagnosis of a family member, of a loved one, and then what do you do? What do you do with this information? What does it mean? What can I expect as a caregiver? And then I'm not prepared. You're just put into this situation because of circumstance, but you have no training. So it's a great thing that you're doing this caregiver college and training for caregivers. So your training, is it open to anyone? Is it primarily focused on African American communities? What's
So
your focus?
So our original funding was focused on African Americans, but we can do this with any community.
Hmm.
Um, we can do this with any community, and we have had individuals who are not from the African American background who have joined us for Caregiver College.
Hmm.
And other than that, we are open to whoever wants to come and learn. So of course, we think that this is most valuable for people who are currently caregiving, but there are people who are former caregivers who are also interested. We have not focused as much on people who are formal caregivers, like as in they are caregiving as a profession.
Hmm.
This is really has been focused on informal caregivers, like family members,
Hmm.
who are really need this information because they really have not had formal training.
Right. Okay, okay. What are some things that caregivers should think about? I know we talked a little bit before about advanced planning and documentation. What are some advice? What's some advice or some of the things that if you're a caregiver, you should think about right away?
Um, what educating yourself, I would say would be one of the first um, elements I would add to my toolkit as a caregiver, understanding the disease and the progression of the disease, because it helps you understand everything else, how you need to prepare and what your next steps may look like.
Hmm.
It helps you understand that the disease is in its beginning stages, till the end stage, it can be anywhere from 5 to 20 years. So really educating yourself about the disease and the progression of the disease. Um, I think they also need to surround themselves with a support community with friends, and a care support team as well. And then, as you mentioned, really think considering healthcare directives, end of life planning, getting all of your affairs in order, getting all of your loved ones' affairs in order, to understand, their wishes and can be able to carry out their wishes, um, um, are some of the items. So it's probably the top three that I would consider, Dr. Caban-Holt.
So I think there are, I'd like to add to what Dr. Fortune was saying. So become aware of what resources there are and don't be afraid to ask. Sometimes you might need us, to talk to somebody. Maybe there's a support group that you could take advantage of. There are things like what they call memory cafes. So it can be a time where you can bring your loved one, and you all are like doing a social activity, but you're in there with other people who also are experiencing the same thing, who also are taking care of a loved one with memory loss. And so there's that common bond of understanding, of what you're all are going through, but also you get to get out of the house. And that is really important because it's a high likelihood that people who are doing caregiving become isolated because they feel like they can't go out because their loved one, is having challenges. And so it's really important to find out what resources there are, take advantage of them. We often, caregivers often don't take advantage of everything that's available to them. So we have to be okay saying, I need some help, and it's okay if someone helps me. And, and that help is not necessarily always perfect. And one of the things I really wanted to add to what Dr. Fortune was saying before is, like she gave the scenario in her situation where her brother was really far away and really couldn't be that hands-on helper. But I think it's important, and it can be, I've seen scenarios where there are 10 siblings and only one person is doing all the care, so that happens,
Right.
that one person. But find out how other people can help you. It may not be perfect. It may not be exactly what you want, but can you find something that they can do that they're comfortable with also, that could take something off your plate? So, brother's too far away to be that hands-on help dad get in and out of the bathtub. But, what could he do? Could he handle ordering groceries to be delivered? Could he, order some things that would just take something off of your plate? So it's important to find ways for people to help to the extent that they can. In some way, sometimes it is financial help. Maybe they're helping more financially than they are physically. But anything that can take something off your plate is something that, is some time that you can put elsewhere. And I do want to also emphasize the importance of self-care for caregivers. And I know it's hard, and I know sometimes people feel guilty for taking some time to themselves, but you'll be a better caregiver. You'll have more to give to your loved one if you are not completely spent and completely exhausted. So, if somebody can come in and maybe watch your loved one for a couple of hours so that you can go to Bible study or choir practice or go get your nails done, or take them up on it, do that, ask for it, say that's what I need so that I can replenish, so I can be a better caregiver. So those are some of my suggestions.
Yeah, and I want to add, Allison is correct with that respite care, taking care of yourself. And sometimes you may not have 2 hours, but if you can go and inhale some aromatherapy in the bathroom for 5 minutes to breathe, so it makes a huge difference. It is so important, and I know that because I've had to do that. It is so important to take care of yourself and get out of the taboo of this disease and be willing and open to ask someone for help. And when I hear a lot of times is the help usually comes from the most unexpected places and people, right? It's not always who you think the closest friends or family members, but when you speak up, it can be, I've heard caregivers say, my neighbor, came and volunteered once she heard about it and helped. The church members would come and help out. My husband's daughter, my stepdaughter, her husband's child decided to come. You get it
Mm-hmm.
in the most unexpected places. But again, what Dr. Caban-Holt said, you have to ask and be willing to receive it once it comes.
Mm-hmm. So I just wanted to go back to a question that was kind of on my mind. I know a lot of your research has been focused on primarily African Americans. Have you seen any differences in the African American caregiving experience as opposed to other groups?
So that's a great question.
Mm-hmm.
So there are a few there can be a few differences. Um, African Americans are more likely to put in more hours um, of caregiving.
Mm-hmm.
These are some of the statistics from the Alzheimer's Association has done some compiling information specifically about caregiving.
Mm-hmm.
So definitely check out the Alzheimer's Association website. Um, African Americans have a tendency to do more hours and more intense caregiving. So that is the hands-on activities of daily living and bathing and hygiene and things of that nature.
Mm-hmm.
We're more likely to do more of that, both African Americans and people of other ethnic groups than say our white counterparts. We're also tend to keep our loved ones at home a lot longer and try to manage that as compared to um, utilizing nursing home care
Mm-hmm.
and actual respite services. We tend to take less advantage of community resources.
Mm-hmm.
So I think that there's my impression is that there is a certain stigma that we hold that prevents us from really taking full advantage of help. We don't want, we can't, you know, um, don't want to have this person's reputation, in the community sort of changed.
Mm-hmm.
But I think it's because in some ways we're looking at this as almost like a personality flaw rather than a disease. This is a disease. This is a disease, or these are diseases that are due to loss of brain cells. I mean, just
Mm-hmm.
like any other biological disease. So I think that we have to make sure that people understand it's a disease and the things that the behaviors that may arise from it are from a disease, not from a personality flaw or a weakness.
Right.
And so we have to be willing to take some of that burden off of ourselves.
Mm-hmm.
People make different decisions about whether they feel like nursing home care is appropriate and things like that. But even if, but if that's not appropriate for your situation, make sure you're getting some help so that you don't get worn out. My
Mm-hmm.
concern is that we may, caregivers get worn out and then they get sick and then their
Yeah.
loved one is not going to have that strong advocate on their side. So it's important that we recognize that.
Mm-hmm. That caregiver burnout.
You got it.
Mm-hmm. Mm-hmm.
Absolutely.
Can either one of you just kind of address caregiver burnout?
Mhm. Um, from the research, the reading, one, the burnout is real. There's the exhaustion, so much so that, I mean, if you don't take care of yourself, caregivers can die before their loved ones that they're taking
Mm-hmm.
care of. And the burnout in the African American community is more significant again because we tend to take on um, more, and we already have, and there's possibly already other diseases. They may be dealing with cardiovascular,
Mm-hmm.
other issues with their health, and if they're not taking time to take care of themselves, they have the health issues, they have the guilt and the stress of dealing
Yes.
with and taking care of their loved ones. Um,
Mm-hmm.
um, the burnout. Mm, Anything else you want to add, Allison?
Sure. So there can be signs of burnout,
Mm-hmm.
which can include things like getting colds and things. It makes us more susceptible to catching colds and getting the flu, rapid heart rate, and just the signs of stress where we may be withdrawing from activities, eating more or eating less, as
Mm-hmm.
well as things like sleeping too much or sleeping too little, feeling overwhelmed. So some of managing burnout is recognizing when you're having the signs so that you can do something. And
Mm-hmm.
sometimes I think we're so busy in the doing, that sometimes we don't take a minute, say, wait a second, this is a lot. Let me,
Mm-hmm.
prevent the burnout before I get all the way there.
Right. And I know you'd mentioned that we tend to keep our family members at home longer. And in my research, it's that, like you mentioned, the guilt, like, oh God, you're putting Big Mama in a nursing home, and that stigma in the African American community, that reciprocity. They
Yes,
took our family members took care of
yes,
us, so we're obligated, that obligation and reciprocity to take care of them. And God forbid you do you put them in a nursing home or long-term care, how dare you. So it's a lot, the cultural foundation, the cultural experiences of African Americans that we deal with when we're looking at caregiving. You've
Um,
given
Dr. Paula, can I add a little bit to that as well?
mhm,
Is sometimes what happens is we make a promise,
mm,
uh, and then we feel like we can't ever change that, and then it gets overwhelming.
mhm,
And so I think we, just have to, recognize that, if we keep them at home, say we keep them at home and they're in worse shape at home
right,
because we can't give them that level of care they
yeah,
need.
they need
Um, and then also, there can be better and worse ways to have someone be in care. Um, Visit them all the time. Roll
yeah,
up there in the nursing home and make sure your loved
yes,
one has been dressed and is
mm,
up and is eating and doesn't have bed sores
that's right.
and has clean clothes. So I think the other thing is not to do it in a way that is still active. I've
Hmm.
seen caregivers, their loved ones in a nursing home, and they visit them every day and make sure that they are well taken care of, because you can't, you know, um, place someone in nursing care and then just walk away. That's that's
Hmm.
that's not good
Right.
for them.
Absolutely. They need to see you there. They need to see that you have active family members that are always engaged and present. So yes, definitely. So I know you kind of touched on it, but can you give one or two words of advice to caregivers? If you're a caregiver, what would be your key takeaways for caregivers?
one piece of advice, of course, is after the diagnosis,
Hmm.
find out more information, but try to find a community, a support community, especially if other caregivers going through this.
Hmm.
I hear that all the time. That has made such a world of difference. Just to have somebody talk to that has been through it, maybe that's new going through it,
Hmm.
just to have somebody, just to not feel like it's just me going through
You're
this
in this
and trying
alone.
to navigate it by myself.
Right. Okay. Okay.
Let's see. I guess one word of advice, or one bit of advice might be um, to get a real diagnosis. Make sure that you know what form of dementia your loved one, or in our case, dementia, what form of dementia they are managing, because
Mm-hmm.
that will give you more insight into what to expect for the future. And then make sure that you have a good relationship with your loved one's physician, so that as things change, when things are become different, that you have someone that you can talk to from the medical side as well, to give you guidance and advice. Is your loved one getting proper nutrition? Is there anything else I can do to make sure that they are staying healthy? Something else that I think is also important is to recognize and to get some, as Dr. Fortune was saying, some education on better ways to manage difficult behaviors. There are better ways to deal with the behaviors, and there are not as good ways to deal with the behaviors. And so getting some guidance on that, that is one of the things that we do during our Caregiver College, that you can be better equipped to manage the behaviors and deal with them and prevent them, which will make, a tremendous difference.
Awesome. Thank you. So I know your Caregiver College, it's only in North Carolina.
For
But
now.
For now,
now.
exactly. Right. I always teach my college students, not yet. So it's just in North Carolina for now, but this is something that's definitely needed all over. And I can't wait to hear you expand it. We're going to have to talk online about how we can possibly bring this to New Jersey or even do it virtually so that we can reach more people, because it's such a needed thing. It, as a caregiver, as a previous caregiver, I understand it's so needed, the education, the resources, the information. So I look forward to working with you all in the future to see how we can expand this Caregiver College. Anything else you'd like to say to the Beyond the Care family before we wrap up? Anything we didn't touch on, or anything you can think of?
I really want to emphasize, take care of yourself. Reach out and communicate to people. Don't be afraid to ask for help.
Okay.
Participate in research. There's lots of research opportunities out there, and that's going to help us develop better treatments and hopefully one day a cure, put us out of business. I would love that. I'd love to never talk about Alzheimer's again.
Yes.
Wonderful. So we will put your information up on the screen for those of you who are in North Carolina who may be interested in reaching out to you and finding more about your Caregiver College. We'll definitely put your information up. And I just want to thank you for imparting this information and knowledge with our audience today. It's such a great conversation, such great advice that you gave. Definitely we need to participate more in research, and as caregivers, take care of ourselves. So thank you, Dr. Fortune. Thank you, Dr. Allison.
Thank you for this opportunity.
Yes, thank you.